Tiazac tablets is used to treat high blood pressure, hypertension, and prevent chest pain, angina. The active ingredient in Tiazac, diltiazem, is a calcium channel blocker. Lowering high blood pressure helps prevent strokes, heart attacks, and kidney problems. When used regularly, diltiazem can decrease the number and severity of episodes of chest pain from angina. It may help increase your ability to exercise. Diltiazem works by relaxing blood vessels in the body and heart, so blood can flow more easily. Diltiazem also lowers your heart rate. This effect helps the heart work less hard and lower blood pressure. Indications. Tiazac is indicated for the treatment of hypertension. It may be used alone or in combination with other antihypertensive medications. Tiazac is indicated for the treatment of chronic stable angina. How to use. Hypertension. Dosage needs to be adjusted by titration to individual patient needs. When used as monotherapy, usual starting doses are 120 to 240 mg once daily. Maximum antihypertensive effect is usually observed by 14 days of chronic therapy. Therefore, dosage adjustments should be scheduled accordingly. The usual dosage range studied in clinical trials was 120 to 540 mg once daily. Current clinical experience with 540 mg dose is limited. However, the dose may be increased to 540 mg once daily. Angina. Dosages for the treatment of angina should be adjusted to each patient's needs, starting with a dose of 120 mg to 180 mg once daily. Individual patients may respond to high doses of up to 540 mg once daily. When necessary, titration should be carried out over 7 to 14 days. Sprinkling the capsule contents on food. Tiazac capsules may also be administered by carefully opening the capsule and sprinkling the capsule contents on a spoonful of apple sauce. The apple sauce should be swallowed immediately without chewing and followed with a glass of cold water to ensure complete swallowing of the capsule contents. The apple sauce should not be hard, and it should be soft enough to be swallowed without chewing. Any capsule contents apple sauce mixture should be used immediately and not stored for future use. Subdividing the contents of a Tiazac extended release capsule is not recommended. Contraindications. Diltiazem is contraindicated in patients with sick sinus syndrome except in the presence of a functioning ventricular pacemaker, patients with second or third degree AV block except in the presence of a functioning ventricular pacemaker, patients with severe hypertension, patients who have demonstrated hypersensitivity to the drug, patients with acute myocardial infarction and pulmonary congestion documented by X-ray on admission. Warnings. You should not use Tiazac if you have very low blood pressure, a serious heart condition such as sick sinus syndrome or AV block, unless you have a pacemaker or if you have recently had a heart attack and you have a build-up of fluid in your lungs. Before taking Tiazac, tell a doctor if you have kidney disease, liver disease, or congestive heart failure. Tiazac may impair your thinking or reactions. Be careful if you drive or do anything that requires you to be alert. Do not stop taking this medication without first talking to a doctor. If you stop taking this medicine, suddenly your condition may become worse. Tiazac may be only part of a complete program of treatment that also includes diet, exercise, and other medications. Follow your diet, medication, and exercise routines very closely. If you are being treated with high blood pressure, keep using Tiazac even if you feel well. High blood pressure often has no symptoms. What to avoid? Avoid drinking alcohol while taking Tiazac. Avoid taking an herbal supplement containing St. John's wort. Avoid driving or hazardous activity until you know how this medicine will affect you. Your actions could be impaired. Tiazac side effects. Get emergency medical help if you have signs of an allergic reaction to Tiazac, hives, difficult breathing, swelling in your face or throat, or a severe skin reaction, fever, sore throat, burning eyes, skin pain, red or purple skin rash with blistering and peeling. Call your doctor at once if you have chest pain, slow heartbeats, pounding heartbeats or fluttering in your chest, a light-headed feeling like you might pass out, or heart problems, swelling, rapid weight gain, feeling short of breath. Common Tiazac side effects may include swelling, dizziness, weakness, headache, nausea, or rash.